How to flush out intestinal parasites and support your gut naturally. Senior health. A woman in her late 60s had meticulously followed all the recommended health advice. Despite seeing multiple physicians over 2 years and having her thyroid levels checked twice with normal results, she continued to struggle with persistent exhaustion. She was prescribed iron supplements for low normal ferritin levels and melatonin for non-restorative sleep. Doctors attributed her fatigue to aging, potential mild depression, or the stress of retirement and adjusting to a slower pace of life, advising increased exercise, which she diligently incorporated. Yet she remained profoundly tired. Upon reviewing her comprehensive health picture, focusing not just on individual symptoms but their progression over time, a disconnect became apparent. Her iron levels were not improving as expected with supplementation, and her sleep remained unrefreshing despite the melatonin and improved sleep hygiene. She had also developed a concerning and embarrassing pattern of intermittent bloating, which would subside for a week only to return for several days before disappearing again. Almost as an afterthought, she mentioned a recurring itch, primarily at night, which she had dismissed as dry skin and hadn't shared with previous doctors, assuming it was unrelated. A pivotal question was posed. When was the last time anyone had thoroughly investigated the health of her digestive system, not just for common bacteria or a basic colonoscopy, but with a specific evaluation for intestinal parasites? The answer was never. 3 weeks later, a comprehensive stool analysis provided the answer. This situation is not an isolated case of misfortune or rarity. It highlights a significant oversight in how persistent tiredness, digestive issues, skin complaints, and the subtle, long-term signals our bodies send are often perceived and investigated within healthcare. This gap in understanding needs to be addressed. For years, a medical professional has observed adults, predominantly in their later years, presenting with symptoms that have been treated but not resolved, believing that the body communicates through comprehensible signals and that individuals over 60 possess a greater capacity to understand these signals than often acknowledged by the medical system. Intestinal parasites are not a foreign concern limited to distant lands or different living conditions, as commonly assumed by many. The World Health Organization estimates that over 1.5 billion people worldwide are affected by soil-transmitted helminths at any given time, and this figure does not even include protozoal infections like Giardia and Entamoeba, which are regularly detected in water and food supplies across North America and Europe, even in areas with advanced sanitation. Giardia, in particular, is the most frequently diagnosed intestinal parasite in the United States. This information is not meant to cause alarm, but rather to underscore that the assumption that such infections are impossible for oneself, based on lifestyle or location, may prevent the crucial question from being asked. There are 5 key signals to consider. While the presence of all 5 does not definitively indicate a parasitic infection, each one, especially when occurring in combination, in cycles, or persisting despite other treatments, warrants closer examination. The first signal is a deep-seated fatigue that is unresponsive to sleep. This is a distinct type of exhaustion, different from tiredness that dissipates after a good night's rest. It is a pervasive weariness present from the morning onward, often described as a feeling of heaviness, as if energy is being consumed before it can be utilized. After the age of 60, this symptom is frequently attributed to aging, which serves as a convenient explanation. However, when fatigue persists for weeks, accompanies other digestive symptoms, or coexists with slightly low iron or B12 levels without a clear reason, investigating the gut becomes paramount before accepting aging as the sole cause. The second signal involves digestive irregularities that follow a cyclical pattern. This can manifest as alternating periods of constipation and loose stools, interspersed with weeks that feel relatively normal before the pattern repeats. Many individuals adapt to these cycles, adjusting their diet, trying probiotics, or increasing water intake. While some measures may offer temporary relief, the cycling persists. This pattern is often associated with organisms that possess their own biological rhythms, influencing the gut's responses in waves. While not conclusive proof, it is a notable observation. The third signal is an intense craving for sugar and refined carbohydrates. This often surprises people who might attribute it to stress, habit, or blood sugar instability. While these are valid causes, certain parasites, particularly those that thrive on glucose, can also interfere with the gut-brain communication pathways that regulate appetite. It is important to clarify that a sugar craving in itself does not automatically mean a parasitic infection. However, when an individual over 60 reports a sudden increase in carbohydrate cravings alongside persistent fatigue and digestive cycling, without any changes in diet or stress levels, this combination warrants further investigation. The fourth signal pertains to skin changes without an apparent cause. This can include eczema-like patches, recurring hives, adult acne appearing for the first time or returning after years, or persistent itching on the limbs or trunk. While dermatological conditions can explain these symptoms, the gut and skin are intricately connected through a complex network of immune signaling. When the gut's protective mucosal barrier is compromised, which can be a consequence of parasitic infections, immune activation can manifest on the skin in ways that seem disconnected from the digestive system. The fifth signal, which was too embarrassing for the individual to initially mention, is nocturnal perianal itching. This itch around the rectal area, typically occurring at night, is often attributed to hemorrhoids, dry skin, or diet. However, it is a hallmark symptom of pinworm infection, a remarkably common parasitic infection, especially in households with children or those attending school. Female pinworms migrate to the perianal skin at night to lay eggs, and the itching is the body's reaction to this migration. This symptom is highly specific and is rarely disclosed during medical appointments unless specifically inquired about. These 5 signals, when considered individually, may seem minor. However, when they occur together and are supported by a relevant medical history, they form a compelling case for a different diagnostic approach. The current approach to managing these symptoms in standard clinical practice is concerning. When a physician orders a stool test for digestive complaints, it typically involves a stool culture, which is designed to detect bacteria such as Salmonella or E. coli, but not parasites. To identify intestinal parasites, a different test is required, a stool ova and parasite examination. However, even this test has limitations, as parasites do not consistently shed eggs, and a single sample on one day may yield a false negative result even with an active infection. Guidelines often recommend testing 2 to 3 stool samples collected on separate days for suspected parasitic infections. Furthermore, specific antigen tests for Giardia and Cryptosporidium are more sensitive and must be specifically requested, as they are not included in standard stool cultures. This creates a critical gap. A physician may order standard tests, receive normal results, and move on to other potential explanations without ever considering or ordering the appropriate parasitic evaluation, not due to negligence, but because the thought simply does not occur due to the common misconception that parasitic infections are rare in certain populations. After years of clinical experience, it has become evident that this assumption can lead to months and sometimes years of unnecessary suffering for patients. Individuals may be prescribed antidepressants for fatigue-related mood changes, undergo multiple iron supplement trials without improvement, or be diagnosed with irritable bowel syndrome for digestive symptoms that are actually caused by undetected parasites. This highlights a fundamental disagreement with the medical tendency to treat isolated organs rather than the entire ecosystem of the gut. The gut is not a series of disconnected issues. It is a complex environment. If an organism that does not belong there is present, addressing the downstream problems individually will not resolve the root cause. Consider the gut as an inhabited territory. The lining of the small intestine, when spread out, is vast, akin to the size of a tennis court. It is covered in tiny finger-like projections called villi, responsible for absorbing all the nutrients the body needs, including iron, B12, zinc, and fat-soluble vitamins. These villi also form the initial barrier between ingested food and the bloodstream. When an organism establishes itself and competes for this space, the consequences can be significant. Helminths, such as roundworms, hookworms, tapeworms, and pinworms, attach to the intestinal wall. Some, like hookworms, feed directly on blood, while others consume partially digested nutrients before the villi can absorb them. A moderate hookworm infection can lead to daily blood loss substantial enough to cause iron deficiency anemia that does not respond well to oral iron, not because of inadequate intake, but because of ongoing internal loss. Tapeworms are particularly adept at depleting vitamin B12. Even with supplementation, stable B12 levels may not be achieved because the parasite is absorbing it first. Protozoa like Giardia operate differently. Instead of burrowing, they coat the intestinal lining. A heavy Giardia infestation creates a physical obstruction over the absorptive surface of the small intestine, preventing nutrients from reaching the villi. This leads to widespread malabsorption of fats, fat-soluble vitamins, and carbohydrates. Giardia also disrupts the tight junction proteins between intestinal cells, which are crucial for maintaining the integrity of the gut barrier. When these seals weaken, the immune system within the gut wall becomes activated, leading to low-grade inflammation. This inflammation, while not overtly apparent, can contribute to chronic fatigue, cognitive fog, and immune dysregulation over time. This cycle is crucial to understand, as it is often missed. Parasites deplete nutrients, weakening the immune response. A compromised immune system allows parasites to persist and multiply. Increased parasitic load generates more inflammation, which further damages the gut lining. This compromised lining absorbs fewer nutrients, leading to further deficiencies. The body continues to send signals in the form of fatigue, skin changes, mood shifts, and an inability to feel rested. But because each signal is treated in isolation, fatigue with supplements, skin issues with creams, mood with medication, the cycle continues. Several changes occur in the gut environment after the age of 60, each shifting the balance in favor of organisms that should not be present. Firstly, gastric acid production, a critical defense mechanism, often declines with age. This is exacerbated by the widespread use of proton pump inhibitors and H2 blockers, medications that intentionally reduce stomach acid for conditions like reflux. While beneficial for their intended purpose, they also diminish one of the gut's primary defenses against ingested pathogens. Secondly, gut motility, the rhythmic contractions that move digestive contents, slows down with age. This increased transit time provides more opportunity for organisms to establish themselves and can contribute to the alternating patterns of constipation and loose stools commonly experienced by older adults. Thirdly, the immune system undergoes age-related changes, a process known as immunosenescence. This results in a less responsive immune surveillance within the gut, allowing parasitic infections that a younger immune system might have cleared without symptoms to gain a foothold. Finally, the gut microbiome, a diverse community of bacteria, tends to decline in diversity with age. A less diverse microbiome is less resilient and more vulnerable to disruption by parasitic organisms, especially when already compromised by factors like antibiotic use, dietary changes, or chronic stress. It is important to emphasize that these changes do not mean everyone over 60 has a parasitic infection. However, if the body is sending these signals, particularly after travel, consuming water from an uncertain source, or experiencing a gastrointestinal illness that never fully resolved, the threshold for investigation should be lowered. If several of the described signals are recognized, persistent fatigue unresponsive to sleep, cyclical digestive issues, unexplained nutritional deficiencies that don't improve with supplementation, nocturnal itching, or skin changes without a clear dermatological cause, it is imperative to discuss these specifically with a physician. Do not wait for the doctor to raise the issue. Ask by name for a comprehensive stool, ova, and parasite examination, ideally collected over 2 or 3 separate days. If Giardia is suspected, request a specific Giardia antigen test, as the standard ova and parasite exam may miss it. It is important to remember that advocating for oneself by requesting a specific test is not being difficult. It is providing relevant clinical information and actively participating in one's own healthcare. For confirmed parasitic infections, particularly helminths, pharmaceutical treatment is often necessary, and effective anti-parasitic medications are available. While natural approaches can be supportive and preventive, they should not replace prescribed treatment for a diagnosed infection. If testing is negative, but symptoms persist, the conversation should not end. A single negative result does not definitively rule out an infection. It merely reduces the probability, and the inquiry should remain open. The importance of meticulous hygiene and preparation, even for simple food items, can be understood through traditional wisdom. Some natural compounds have demonstrated anti-parasitic properties, aligning with long-standing empirical knowledge. 4 such examples include garlic, pumpkin seeds, clove, and ginger. Raw garlic, when crushed or chopped, releases allicin, which has shown activity against various intestinal parasites, including Giardia. Clinical relevance requires raw garlic consumed shortly after preparation, as allicin degrades over time. Pumpkin seeds contain cucurbitacin, which appears to temporarily paralyze certain helminths, hindering their attachment to the intestinal wall. Consistent use of a significant handful of raw, unsalted seeds over several weeks has shown measurable effects. Clove is particularly interesting for its activity against the eggs and early larval stages of certain parasites, due to its compound eugenol, potentially disrupting the reproductive cycle. Ginger possesses documented antimicrobial and anti-inflammatory properties, improves gut motility for mechanical expulsion, and supports the gut lining, making it a tolerable daily addition. These natural agents are not replacements for antibiotics and are not potent enough to treat confirmed infections. However, when incorporated consistently into a diet rich in fiber and adequate hydration, they can help create a less hospitable gut environment, support gut lining immunity, and contribute to a biochemical milieu that is more challenging for parasites to exploit. Soluble fiber, found in oats, flaxseed, and legumes, acts as crucial scaffolding for gut function, slowing digestion, nourishing beneficial bacteria, and aiding elimination. Most adults over 60 consume insufficient fiber for their gut's needs. Prompt medical attention is warranted if any of the previously mentioned signals are accompanied by unintentional weight loss, visible blood in the stool, consistently pale or foul-smelling stools, severe fatigue impacting daily function, recent travel to areas with unreliable water treatment, a lingering gastrointestinal illness, or a compromised immune system. In such cases, the conversation with a physician should be immediate. The aim of this discussion is to empower individuals to engage in more informed and specific conversations with their healthcare providers, leading to more effective clinical outcomes. The body sends clear, specific signals, and the challenge lies in how these signals are categorized and addressed separately. Fatigue, digestive issues, skin problems, and nutrient deficiencies are not isolated events, but can be interconnected. Sometimes the missing piece is simply that the right diagnostic question was never asked. Recovery, as seen in the case of the individual previously discussed, may not be immediate, but requires proper treatment and dedicated gut rehabilitation. Understanding the impact of intestinal parasites on the gut's bacterial environment, depleting beneficial organisms, causing inflammation, and altering conditions for bacterial thriving makes restoring the bacterial community a critical concern. This recovery often occurs in layers, and the bacterial layer is frequently overlooked. Therefore, self-care involves paying close attention to the body's signals and seeking appropriate investigation and treatment.